Chapter 11, the nurse's role in women's healthcare, which is huge depending on what part of the women's healthcare field you get into. It's a pretty important aspect of it for women. Okay, so we're going to explain aspects of preventative health care for women, menstrual disorders, and gynecological infections, and what we're going to do about them. So, as you know, there was Healthy People 2010, 2020, 2030. Unfortunately, 2010, 2020, we didn't meet a lot of the goals, but they're called goals for a reason. That's what we hope to achieve, right? It's a nationwide health initiative, and for the Healthy People 2030, the goals related to women's health are increasing the number of women over the age of 40 who get mammograms to help curb the rise in breast cancer, increasing the number of women over 21 who have pap tests to reduce the number of deaths from cervical cancer. That can significantly help with that. Reducing occurrence of fractures in the vertebrae and hips of older women with osteoporosis, and reducing occurrence of STIs and PIDs. You know, women from all ethnic backgrounds now are really wanting to become, a lot of them, not everybody, but they aren't as passive as they used to be in their healthcare. They want to be more involved. They read more things about it. They want to know more about their bodies and self-care techniques. So, culturally competent communication is just super important for us to be aware of. You guys keep learning this ad nauseum, but it really is an important factor for us to know. So again, in some cultures, like even doing a thumbs up can mean a bad thing, where in our country it's like, yeah, okay, I agree, yay, thumbs up. And a nod can mean something different. So we have to be very culturally aware of those things, okay? And we can't let our own prejudices guide us. We have to respect our patients' wishes. And as that nurse, we have to offer support, knowledge, and caring behaviors to help these women. Some of these things, pap tests, mammograms, think of some of the results some women get. It certainly isn't the result they were hoping to hear. So we have to be supportive. Okay, so preventative health care for women. Of course, early identification of the disease is very crucial. May include these characteristics, these disorders exclusive to women: cervical cancer. Dominant in women, of course, is breast cancer and osteoporosis. Men can get breast cancer, but it's dominant in women. Osteoporosis is just more common in women. Prevalent in the general population is hypertension and colorectal cancers. So those are all things that we need to be aware of and help the patient with. So achievement of goals require preventative care, screening, and increased accessibility to health care. And that is the goal that we have and we need to try to focus on. So this chapter focuses on all those disorders that are exclusive to women, and the screening exams. As I explained to my patients, screening is very different than diagnostic. Screening, like, for example, our hearing screens on newborns. It tells us that they need further diagnostics. So we just screen them with a simple little tool and say, oh, something's not working quite right. We need to get diagnostic information. So that's kind of what I mean by that. So screening tests are like breast self-examination. So we teach our patients to do this if you worked in a clinic, an OB office, things like that, or a family planning offices, things like that. It begins during adolescence, and we need to teach them to perform it about 1 week before each period. Best screening option for detection of breast cancer. It's super important for women to do this monthly. And then mammography, of course, it's a soft tissue radiographic image, can detect lesions before they are felt. And the pap test examines cells from the cervix. Okay, breast care, page 260. The things that are the approaches for early detection of cancer are monthly breast self-exams, should be performed about the same time each month. Annual professional breast exam, so you go to your provider and they also check your breast to make sure you didn't miss anything. And they're just trained a little bit more on what to feel for, right? So, but the reason why we have a woman do her own at home is the woman gets to know her own breasts. Some people can have fibrocystic breasts that can make them very lumpy. Well, that might be normal for that woman, and she knows it. And so she knows, okay, that lump there, I had a mammogram last year, and they said it was just a fibrocystic portion of my breast, so I don't need to worry about that unless it grows or gets firm or changes, right? So lots of our lumps in women's breasts are hormonal fluctuations. So it's easier for a woman throughout the month to keep an eye on things she may feel at one time of the month, and if it's gone a week later, then it was just hormonal. So the woman knows best usually, if she's really up on it, if there's changes in her breast to worry about. Now, this picture I have on here, oh my God, I found a lump. More power to you. So the power to detect that breast cancer is literally in your hands. So it says breast self-exam is effective in detecting 70% of breast abnormalities. 40% of diagnosed breast cancers are detected by women who feel a lump, and it feels like a hard rock in the breast 78% of the time. Some offices women go to have these fake little boobs, and they train you on them what to feel for. They can feel like a hard little bean or pea, but they're usually firmer and immovable as compared to a fibrocystic change. Okay, so a lot of women I've heard that have had issues, they've been scared. They may have felt a lump but didn't do anything about it because they were scared to get the result, which is a terrible reason, because then you're dealing with a lot worse things if you wait too long. But fear is a very powerful thing. Okay, and then of course, mammography as appropriate. So I loved this. Anyone who's had a mammogram can relate to this, I think. The Boob Squash 3000 mammogram machine, and I love this. I'm going to be working late tonight, honey. I've got about 20 more feet of boob to screen. Old women who have these saggy boobs that some of the girls at work tease about, rolling their boobs up into their bra after they breastfed 4 babies, things like that. It's just, I thought this was hilarious. So again, the mammogram can detect a tumor long before it can be felt. And of course, the nurse's role is to educate women about the benefit of all these exams and how important it is to get this done. And remember that breast self-exam is a supplement to, not a substitute for, regular professional examinations also. So those yearly pap smears and, well, pap smears are not always done yearly now, but anyways, yearly physicals are just very important. And then, the mammogram, just to say a little bit more about that, it's a very low dose x-ray to visualize the breast tissue. And as you saw, the breast is compressed firmly between 2 plates, which is briefly uncomfortable. Any woman who's had it knows that they squish you like a pancake. And scheduling the mammogram after a menstrual period reduces the discomfort. It's not that tenderness of your hormones going crazy in your breasts. The American Cancer Society currently recommends an annual mammogram for all women age 40 or older. And of course, women at higher risk for breast cancer may begin mammographies earlier in life. And the breast cancer risks that, you're not going to find this in your book, but I had this and I just thought it was a good thing to know. I know you guys have learned this before, but anyways, genetic inheritance, the BRCA genes, and age greater than 50 years old, family history of premenopausal breast cancer, use of alcohol, smoking, high-fat diet, high caffeine intake, early menarche, late menopause, and never had a baby. Okay, never been pregnant. Okay, Then we move on to the vulvar self-exam. Should begin at about 18 years of age or younger if they're sexually active. And you teach your patient to perform this monthly to identify lesions or masses that you might worry about infection or malignancy. So the woman gets this mirror, as you can see, and visually inspects and palpates the external genitalia. In the labia there can be tumors, things like that. And they get that hand mirror so that you can see what's down there also, so you can compare to see if things have changed from month to month. So they also look for painful inflamed areas, ulcers, sores, or changes in skin color. And of course, if there's any abnormalities, that needs to be reported to the doctor. Knowledge is power. All right. Pelvic exam, the thing every woman looks forward to every year. But ACOG, the American College of Gynecologists, say that pelvic routine exams should be a shared decision between the woman and her healthcare provider. So it's a matter of the need, and let's discuss what it entails. Things like that should be scheduled between menstrual periods. And what we want to do is identify conditions such as tumors, abnormal discharge, infections, or unusual pain. And they can find things. When I went for mine one time, the doctor found a tumor in my right ovary. Thank God it was negative, it was benign, but how scary, and I had no idea it was there. So pelvic exams can be very important to catch things early. And then, of course, the PAP is obtained to screen for changes in the vaginal and cervical tissues. And if they're precancerous, we do something about them. So the woman should not douche or have sexual intercourse also for at least 48 hours before the PAP test, because that can skew the results. So the current guidelines for getting the PAP done in sexually active women are every 3 years for women aged 21 to 29. Every 5 years for women aged 30 to 65, and no screening necessary for women over the age of 65 with negative screening for the past 10 years. How nice. And of course, if you've had a hysterectomy with removal of the tubes also, and the ovaries. Okay. So also just know that the healthcare provider checks external and internal. They use a speculum for the internal to visualize the woman's cervix and vagina for any inflammation, discharge, or lesions. And it's very nice when the doctor or nurse prac warms the speculum and lubricates it with warm water before inserting it for the comfort of the woman. Okay, and after the PAP test is obtained, then they do the bimanual exam. So they put a hand, fingers inside, and on the outside the other hand, and palpate the ovaries and things to check for size. Then, after the internal exam, a single lubricated finger is inserted into the rectum to identify hemorrhoids or other lesions. They also usually take that finger out and you put it on the occult blood test to make sure if if your patient is having rectal bleeding that they don't know about. Okay, on to menstrual disorders. So they can cause distress for a lot of women. It can be scary, it can be uncomfortable, it can be messy, when women all of a sudden have mid-cycle bleeding, things like that. So common nursing roles for us are explaining any recommended treatments, caring for the woman before and after procedures, and always our role is providing emotional support. Okay, amenorrhea. This is not normal. Okay, it is the absence of menstruation. It's normal, of course, before the period starts, during pregnancy and after menopause. But other than that, it's not normal. So there's two different kinds. There's primary, which is failure to menstruate by age 16. Failure to menstruate by age 14 if she has not developed any secondary sex characteristics. Then they start having to do some testing. Secondary is cessation of menstruation for at least 3 cycles or 6 months in a woman who's had an established pattern of menstruation. Sometimes it's weight loss, sometimes it's hormonal your hormones going insane, things like that. So treatment depends on the cause, of course. And pregnancy testing is one of the first tests you should do. Make sure if they are pregnant why they aren't having a period. But they can also, they do a thorough H&P, do lab work, and it's more of a common thing in thin or low percent body fat women because fat is needed for estrogen production. And of course, estrogen is a huge part of menstruation. Could be an endocrine imbalance, and adolescents who are obese may have polycystic ovaries, which is a whole nother ball of wax. Okay. Then abnormal uterine breathing. There are 3 types, whether it be too frequent, too long in duration, or excessive in amount. So menorrhagia, normal in amount but occurs at irregular intervals. Menorrhagia, excessive in amount. So what's considered excessive? Normal is 35 mils of blood. Excessive is 80 mils. So that can result in anemia. So we've got to figure out what's going on with that. And common causes of that are bleeding disorders, pregnancy complications, lesions in the vagina, cervix, or uterus, breakthrough bleeding when a woman's on contraceptives. Sometimes that happens, and if it continues to happen, they may have to get their pill changed over. Endocrine disorders or failure to ovulate. Okay, menstrual cycle pain is what a lot of women deal with, and it's miserable. So middle schmerz, middle pain, is pain that many women experience around ovulation, and it's harmless, but it hurts. Dysmenorrhea is painful menses or cramps. So we have 2 of those also. Primary, which is no abnormality, but it causes girls to stay home from school, things like that, because it's miserable. And usually pelvic exams are normal. They just have these horrible cramps. Secondary is pathological usually. Endometriosis, IUD, PID, we're going to get into these things in a little bit. Uterine polyps or ovarian cysts are present. So vasopressins can cause an issue, and also prostaglandins from the endometrium uterine lining contribute to the pain. They are potent stimulants of painful uterine contractions. Think about this. We use prostaglandins to induce labor. So you can imagine that it causes a woman painful uterine contractions when they're not pregnant. So treatment for those kind of pains there's different ones, 3 treatments, and a lot of them are, of course, like ibuprofen, naproxen, things like that, anti-inflammatories. Heat application to lower abdomen, and some doctors put their patients on oral contraceptives for which reduces the amount of endometrium buildup each month, and it reduces prostaglandin secretions. So I remember when I was young, I was 2 days on the floor rolling in pain, and then ibuprofen saved my life. And that and birth control pills, just, it's amazing. And lots of times if the patient's mother had issues, so will the daughter. Okay, endometriosis. It's the presence of tissue that resembles the endometrium, but it's outside of the uterus. Do you know they have found endometriosis even in women's brains? It's really bizarre. But normally it's just right outside the uterus. Tissue responds to hormonal stimulation just as the uterine lining does. So you can imagine if it's in different places, a woman feels the pain where that endometrial tissue is. It's really kind of weird, isn't it? So look on the side there. You can see where those, on the top picture, you can see those little round circles of endometrial tissue attached to the tube and to the left ovary. And then on the bottom, on the right, coming out, that dark purple stuff, that's endometrial tissue. So just kind of odd. So it can cause pain, pressure, inflammation. The pain can be sharp or dull. It's usually a little more constant than spasmodic. Can cause painful sexual intercourse, infertility in some women. Treatment is either medical or surgical, depending, of course, on how severe it is. So medications such as danazol, which is an agonist of the gonadotropin-releasing hormone, can be administered via nasal spray to reduce the buildup of the tissue by inducing an artificial menopause. So we're getting a little complicated here. Lupron, given in IM, is also effective. She can have hot flashes and vaginal dryness from all that too, though, the treatment. There's also, you can do hysterectomy if the woman's done having children, but if she's not, they can do this laser ablation. It's destruction of the lesions to maintain fertility. And then endometriosis has no effect on pregnancy once pregnancy has been achieved. It doesn't cause issues, so that's kind of important to know. Okay, so this is a slide that I added that I thought was just interesting stuff. So causes can include retrograde menstrual flow that transplants endometrial tissue outside of the uterus. Thought that was really interesting. A hereditary tendency or an immunologic defect. So management varies with, of course, severity of pain, extent of the disease. Do they want children or more children? How old is this person dealing with this? Threat to GI or urinary tract. Has this endometrial tissue attached to the GI or bladder? Management, of course, are NSAIDs, surgery, laser therapy. Okay, so premenstrual disorders, they can get real complicated. And poor women just can be miserable. I like this picture I found. That moment when PMS kicks in and she realizes it's a nasty way to kill you. My friend at work, until she got a hysterectomy, she's like, every month I would practically be suicidal and I'd ask for a divorce every month. Then when I'd get over it, everything was fine. Just made her a raving lunatic. Just did. So there's truly hormonal issues with this. It was formerly called premenstrual syndrome. It's associated with abnormal serotonin response to normal changes in estrogen levels. Symptoms occur between ovulation and the onset of menstruation. So before the period, a lot of family members can know when it's coming because of the way the woman acts, and a lot of women get offended when a man says, oh, it must be that time of the month coming, things like that. But it can be true. It's a woman's hormones going wacky. They are not present the week after menstruation has occurred. They're usually back to normal by then. But it can be very miserable. And let's see, let's move to the next slide. Symptoms of it. So you must have 5 or more regularly to establish this diagnosis, okay? So 5 or more must occur regularly. Depressed mood, anxiety, tension, feeling just on edge, just edgy. Increased sensitivity to rejection, just very, sensitive. Irritable. Decreased interest in usual activities, difficulty concentrating, tired, lethargy, change in appetite, whether it be more or less, change in sleep habits, feeling overwhelmed. Physical symptoms are breast tenderness, bloating, weight gain, headaches. Okay, so you got to have, and the diagnosis is often based on established pattern throughout more than 3 months of getting these symptoms, okay? And so let me tell you my joke. Have a sense of humor, because I love this joke. It's one of my absolute favorites. Okay, so there's this woman and she's reading this magazine and it's all about these symptoms. And she's like, reading it and going, oh my gosh, I have that, I have that, I have that, I have that. I think I have PMS, PMDD. So she goes to the doctor and she goes, doctor, I think I have figured out what's wrong with me. I think I have PMS. So he goes, okay, we'll run some tests and we'll get you figured out. So he runs tests and everything and he comes back to her and he goes, well, I have some good news and some bad news. She goes, okay, give it to me straight, doctor. The doctor says, the good news is you don't have PMS or PMDD. The bad news is you're just a bitch. Okay, don't get me in trouble for that. Oh, I even recorded it, didn't I? Anyways, just to make you laugh today. Moving on. Treatments for PMS and PMDD: stress management, low-fat, high complex carbohydrate diet, oral contraceptives, diuretics. Some women get very bloated during that time, and SSRIs, and that gonadotropin-releasing hormone, avoiding high salt intake, and reducing caffeine. Those are all things that can help. But a lot of these things have to be initiated 2 weeks before menses and discontinued when menses begins. So it's something that has to be established in that way. Okay, I liked this too. PMDD. Oh, you have a cold? How rude of me. I just laid an egg and now my body is violently ripping down the walls of my uterus. But can I get you a tissue? It's true. Women feel that way when that's happening to them. Okay, now let's move on to the normal vagina. Okay, so the interaction, okay, actually let's go to page 264 in the first paragraph under the normal vagina. I just thought this was very interesting. At birth, the infant's vaginal epithelium is controlled by estrogen from the mother. That's also why little girls, baby girls, can have a period in their diaper, because of mom's hormones circulating through the newborn. And so anyways, it's estrogen from the mother and is rich in glycogen with a low pH of 3.7 to 6.3. When the maternal estrogen effect decreases, the vaginal epithelium atrophies and contains little glycogen, and the pH rises to 7, which is a normal pH. Then estrogen influence returns at puberty and glycogen increases. Okay, so the interaction of glycogen and estrogen in the vaginal epithelium results in growth of lactobacilli, which is what is our bacteriostatic action. So it helps with bacteriostatic. It works against bacteria, right? So that's what we want in the vagina so that they don't get infections. pH falls to 3.5 to 4.5, and types of bacteria found in the vagina vary with the pH of the vagina. And we'll get into what to do to prevent any issues with that. Okay, so one of the things that, or a few of the things that can affect this, the normal flora: antibiotics. Antibiotics not only can affect birth control pills, but can affect the pH of the vagina. So it can encourage yeast overgrowth. Douching changes the pH in the vagina. A lot of women douche because they feel it makes them feel cleaner, but it can really upset the pH in there. Sexual intercourse raises pH to 7 or higher for up to 8 hours after intercourse. Uncontrolled diabetes mellitus. Think about all the sugar in a woman's body going on and how bacteria loves sugar and sugary areas. It increases glucose, which promotes growth of microorganisms. Okay, so the normally acidic pH of the vagina is the first line of defense against vaginal infection. So if we mess with that, we're messing with our defense. Normal vaginal secretions are made up of creamy white epithelial cells and mucus from the cervix, skin glands, and Bartholin glands. The secretions prevent dryness and infection. So immediately after menstruation, the mucus is thin, but as ovulation approaches, the estrogen level increases. Estrogen's just so huge for women. At ovulation, the mucus is clear and slippery and can be stretched without breaking. That's the Spenbarkite. And after ovulation, mucus is cloudy and sticky. You guys need to know, and we're going to go over it even more, that at ovulation, mucus is clear and slippery. So, how to prevent these vaginal infections that we do not want women to get? We need to teach the woman to wear cotton underwear because it's breathable. Avoid tight nylon or spandex pants, especially just, wearing them a lot. Always teach women for when they're changing babies' diapers and themselves, always wipe front to back after toileting and while changing a diaper. Frequent hand hygiene, always important no matter what you're doing, right? High fiber, low fat diet, exercise, Avoid douching or using internal feminine hygiene products. Okay. Now, we'll go to gynecological infections. So these kind of infections are the most common reason women go to the doctor. And the nurses in those offices play a key role in educating these women about vaginal health and how to prevent getting these sexually transmitted infections. The nurse also needs to identify high-risk behaviors, but we need to be non-judgmental and provide good counseling and education about how to prevent these things for women. So safe sex practices, a reduction in the number of partners, and avoiding the exchange of body fluids are the primary prevention of STIs, as we should all know by now. So there's 3 classes of gynecological infections: toxic shock syndrome, sexually transmitted infections, STIs, pelvic inflammatory disease, PID. We'll talk more about it. Okay. So, of course, again, educating the women is the nurse's role, help them prevent STIs, identify high-risk behaviors, and be non-judgmental. I already said that. All right. So, toxic shock syndrome. It's caused by Staphylococcus aureus, and group A, streptococci. Okay, thank goodness it's rare, but potentially fatal. It's a multi-system infection, and what happens is that the capillary permeability gets affected, which allows the intravascular fluid to leak from these vessels, results in hypovolemia, hypotension, and shock. Direct tissue damage to organs precipitates serious defects in blood coagulation. So you can see how it can be quite serious. Again, it's usually caused by the Staph aureus, but I liked this, that it says the toxins can produce the shock, coagulation defects, and tissue damage if they enter the bloodstream. Usually results from the trapping of bacteria in the reproductive tract for a prolonged period of time. And that is the rationale for not using high absorbency tampons, because they're in there and they trap it for way too long. And so does a diaphragm and cervical cap. It's in there too long and that toxin gets trapped. Symptoms: sudden spiking fever, flu-like symptoms, so they can just feel sick, headache, muscle aches, vomiting, diarrhea, sore throat. Really kind of odd for toxic shock to have a sore throat, right? But that's one of them. Hypotension, generalized rash resembling a sunburn, skin peeling from the palms and soles 1 to 2 weeks after onset of illness, and laboratory tests that show elevated BUN and creatinine, low platelets. So let's see. Prevention, hand hygiene. So using good hand hygiene when women do pericare, when they do put in tampons, pads, things like that. Change tampons at least every 4 hours. Don't use the super absorbent tampons. Use peri pads rather than tampons when sleeping. Don't use diaphragm or cervical cap during the menstrual period, and remove the diaphragm or cervical cap as recommended by the healthcare provider. Okay, so treatment is supportive. Can include hospitalization for administration of vasopressor drugs, antimicrobial medications, and fluid replacement. Okay, now on to STIs. So they're infections, of course, that can be spread by sexual contact, and I know you guys have already gone through all this in Med-Surg, but we'll just do a review. Some have other modes of transmission. Most effective choice of birth control and prevention of sexually transmitted diseases is to abstain from sex. So certain STIs have to be reported, like we're getting a much higher incidence of syphilis back again. They almost stopped doing syphilis testing for pregnant women, but we were seeing too much of it again. So we started really screening, and it's really interesting on what a comeback it's making. So we have to be careful about these things, and that's one of the reportable things. So the incidence of STIs has increased during the past few decades, and we have a lot more casual sex going on, things like that. So teaching STI prevention is important because some viruses, as we know, like herpes, HIV, all that kind of stuff, remains in the body for life and can include long-term complications. HPV, so human papillomavirus, is the most common viral STI, and we're going to go over that. And some can result in cervical cancer, so we've got to be careful about that. So it's important that all sexual contacts of the affected person, even those who are asymptomatic, be completely treated to eradicate the infection. So we need to know who the partners are also, and a lot of times the doctors will treat them too, so that it doesn't keep getting passed around. And again, condoms, we've always learned that condoms prevent sexually transmitted infections, but not always. So it may not protect the woman if the male's lesion is on the scrotum or inguinal folds. And it can take 3 to 6 months after infection to develop visible warts for HPV. So treatment includes for HPV cryotherapy, laser vaporization, just other treatments that you can look at on page 265. And the CDC recommends that a vaccination be given to all males and females between the ages of 11 to 26 to prevent the most common strains of HPV, because there's more than 100 variations of the HPV strain. So they treat the most common ones. Okay, so again, STIs can be spread by contact with bodily fluids from mouth, genitalia, rectum, and blood. The problem with STIs during pregnancy, one of the ones I can think of is trichomonas, can cause spontaneous abortion. It can cause such irritability in there that it can cause the uterus to contract. So preterm birth, intrauterine growth restriction, prematurity, neonatal death, congenital infection, postpartum uterine infection, and we'll go over that. Okay, testing and treatments for STIs. This is an extra little slide that I just thought was interesting. Rapid tests are available for HIV and herpes simplex 2, chlamydia, gonorrhea. Serum blood tests are needed for syphilis, confirmation of a positive HIV, and treatments, of course, for HIV are antiretrovirals, herpes are antivirals like acyclovir and Valtrex, and syphilis is penicillin. All right. Types of sexually transmitted infections. We're moving on, we'll come back to the hepatitis, but we're moving on to table 11.1 on page 266. So candidiasis is yeast, and the issue with us for maternity purposes is it can infect the newborn at birth. So we have to be careful of that. Then trichomoniasis or trichomonas, and it doesn't cross the placenta, but can cause postpartum infection. And then bacterial vaginosis can be associated with preterm delivery. It's a normal inhabitant of the vagina, but it overgrows is what happens. Then chlamydia. It can cause conjunctivitis and pneumonia in a newborn if they're not treated, the mom, before the newborn delivers. Uninfected infection can ascend into the fallopian tubes, causing scarring, infertility, or ectopic pregnancy. And it can spread to the neonate's eyes by contact with infected vaginal secretions. And that's one of the reasons why I really, really encourage parents to let us give that antibiotic ointment right after birth to help treat some of these things. Gonorrhea, if that gets in your eyes, a baby's eyes, it can cause blindness. So that's why we give the prophylactic eye care. And if it's untreated, gonorrhea, it can also result in pelvic inflammatory disease with tubal scarring. So you can have problems with fertility later on. And then here we are with the syphilis. And you can see the chancre, they call it, that paint, that sore that's on, usually it's on in the perineal area somewhere on the labia. It's transmitted across the placenta, and it causes congenital syphilis stillbirth or spontaneous abortion. Syphilis is huge for pregnant women. We test everybody for it. And they get tested during pregnancy and when they get admitted to the hospital. That's how serious it can be. Okay. Then herpes can cause spontaneous abortion, stillbirth. HSV-2 usually causes genital lesions. The first episode is usually the most uncomfortable. When I was in nursing school, I was this just 19-year-old little nursing student, maybe 20, and I was at the hospital and they gave me this 80-something-year-old patient that had had a stroke. And they said, you need to go put a zoelite on her perineum. And I'm like, for one thing, I don't know what a zoelite is, and why, if she had a stroke, would I need to put it on her perineum? Well, come to find out, this poor lady, had aphasia. She could say a few garbled words. Well, I went in there with my little zoelite and looked, and she had her first outbreak in the hospital of herpes. It was this red, ulcerated, goopy mess down there, and the zoelite was supposed to dry it out. And I just remember having to put that light on her perineum, and as garbled as she was with her speech, she said, I could understand that she said, I'm so embarrassed. But think about that. When I think back all these years, she'd been in the hospital for quite some time. I was a brand new nurse, so I didn't really think about it that much at the time, but how did she get it when she'd been in the hospital for a few weeks? Her primary outbreak. That is just a horrible thing to think about. Okay, it's very painful, the primary outbreak. And then the HPV, you should see some of the growths we get. The growth may obstruct the birth canal, so seriously, these warts can not only cover the perineum, but they can grow inside the vagina. And what can happen is, as the baby's head comes down during delivery, they can be torn off. And it can cause bleeding, and it can cause laryngeal papillomas in the newborn. So that can be really wicked. Then getting rid of them is just, if you've got them that bad, can just be so major because there's just so many of them. So it's good that there is a vaccine available if people want to get that. Okay. Then HIV. Problem with HIV is initially there's no symptoms. And so the pregnant woman might not know. So we do HIV testing during pregnancy and when they get admitted for labor if they want to be retested. If they've been, sexually active or promiscuous with more than one person, things like that. So we want to prevent breaks in skin of the mother and fetus during the birth process because it can be transmitted to the newborn. And they usually recommend that the newborn, of course, be bottle fed. And we also do very close monitoring in pregnancy for any complications. So there's fungal and bacterial types of infections that we could deal with. Okay, hepatitis B is back on page 265. And you guys know what hepatitis B is. Inflammation of the liver from a virus can cause liver failure, can be transmitted sexually, IV drug abuse, or intimate contact with blood or body fluids. Symptoms are nonspecific, malaise, anorexia, nausea, fatigue, and immunizations are available for A and B, and there is also a cure for C now, I hear, which is incredible. Okay. HIV remains a worldwide health problem, and we are seeing more. Patient education plays a key role in prevention, quality of life, and compassionate and knowledgeable referral. At what point do we need to get further care for these people? Early diagnosis, access to care, medications, and safe sex practices are improving outcomes. It doesn't mean that we're not seeing HIV, but we're improving outcomes from it. HIV screening with pregnancy is essential. Again, many women don't know they have it, and sexual contact may have is one of the most common risk behaviors. Oops, I screwed up a word. Anyway, okay. Then moving on to page 269, pelvic inflammatory disease. It's an infection of the upper reproductive tract, usually caused by gonorrhea or chlamydia trachomatis. It's asymptomatic, so or the symptoms can vary. They can have fever, chronic pelvic pain, abnormal vaginal discharge, nausea and anorexia, irregular vaginal bleeding. When examined, the abdomen and pelvic organs are commonly very tender. Pelvic inflammatory disease, think about that. People can be very uncomfortable, but in the beginning they can be very asymptomatic until it gets really inflamed. But it can cause infertility. It's a huge cause of infertility these days. So some of the risks are in early onset of sexual activity in multiple partners, can cause ectopic pregnancies, pelvic abscesses and adhesions, and can result in the scarring of the fallopian tubes, again, that can cause blockage and infertility. And that's what also is the problem with ectopic pregnancy. Treatment includes antibiotics and patient education. The thing to teach our patients too is douching results in changes in the vaginal flora and predisposes the woman to the development of PID and bacterial vaginosis and ectopic pregnancies. So here's some pictures of PID. On the left, you see healthy. On the right, see all the redness going up through the vagina, and on the right, see pussy areas. I mean, PID can be wicked. So it's nothing to mess around with. It needs to be treated. Okay. Now our family planning objectives describe various methods of birth control, including side effects and contraindications. We'll talk about natural family planning and causes and treatment of infertility. All right, so family planning. It's influenced by a whole host of factors. So our job is to answer general questions concerning different methods available out there, the advantages, disadvantages, side effects, and long-term effects. Teach correct use of the contraceptive methods they choose, and we need to educate them that contraception doesn't always prevent pregnancy. Each one has a risk. And as we learned, even the pill, well, we're going to learn even the pill, if you take certain medications, can alter the effects of the pill and cause pregnancy. And we also need to teach patients that the optimum timing between pregnancies is 18 to 24 months. Anything sooner than that can there can be preterm labor, the cervix may not be ready, the muscle of the uterus can be tired, things like that. Okay. So here's an extra little slide I put in here that I just thought was good. Factors in selecting contraception. What is the age of the person? What is their health status? Cost of method. What can they afford? What kind of insurance coverage do they have? How effective is the one they want? Availability of that. Impact of unplanned pregnancy on the woman and family if they choose one that doesn't have a really good high success rate. Desire for future children. They're not going to want to get their tubes tied or the dad get a vasectomy if they want future children. Partner support and willingness to cooperate. How many sexual partners are there? Because you don't want to use certain things if it's a lot. How frequent is the sexual intercourse happening? What's the safety of the method for that patient's health status? And protection against sexually transmitted infections. Most of them don't unless it's a barrier method. Convenience and degree of spontaneity desired. Desirability or personal preference. Personal motivation and compliance. And religious and moral factors. Some religions don't want you to take birth control pills. I don't know what the Catholic thoughts are on that, but it used to be against the church's principles. Okay, so natural family planning. Oh, and again, the Healthy People 2030, their goals are as far as family planning, are reduce the percentage of unintended pregnancies to no more than 30%, which that's a high number, unintended pregnancies, right? So I don't know what the actual number is. Reduce the percentage of women who have an unintended pregnancy despite the use of a contraceptive method to no more than 7%. Okay, so now we want to go to this natural family planning. It is reversible. It's accepted to most religions. Acts as a contraceptive by eliminating the possibility of sperm entering the woman's vagina. Involves abstinence during ovulation. Requires no medication or devices. Involves learning how to identify signs and symptoms associated with ovulation, which we'll talk about. Completely effective in preventing pregnancy. If you're abstinent during ovulation, it's completely effective, right? Is a means of avoiding STIs. But failure rate can still be 20% because not enough women really know their body and really know when they're ovulating, or the fact that ovum is viable for up to 24 hours after ovulation and sperm for 48 to 72 hours, right? So people forget that, and then they have unexpected pregnancies. Okay, so types of natural family planning. One is, and we need to know that the understanding is the woman is fertile at ovulation. So we need to confirm that fertility, right? So time of ovulation can be formed by 1, basal body temperature. So the basal temp rises very slightly at ovulation. It rises about 0.2 degrees Celsius, 0.4 Fahrenheit, and remains higher in the last half of the cycle. Now, the thing about basal body temperature to remember, if you're giving advice to a patient, is that it's better at identifying that ovulation has already occurred than predicting that it's about to occur. So it's not always extremely helpful. The most important time point to identify in attempting conception or contraception is the day before ovulation rather than the day of ovulation. So that can get a little bit difficult, that method. Then we have, and there's many factors also that can affect your basal body temperature, like poor sleep, illness, jet lag, sleeping late, alcohol intake the evening before, sleeping under an electric blanket or heated waterbed. So it can make that very unreliable what the woman's true core temperature is, right? Then there's the cervical mucus method, that's also known as the Billings method. As ovulation nears, the mucus increases and becomes thin, slippery, and clear to aid the passage of sperm to the cervix. So the slippery mucus can be stretched 6 centimeters or more and has the consistency of egg white. The stretching characteristics of the mucus is called spinbarkite. So that's the picture on the right lower hand side. See how far she's stretching that mucus? Okay. Then there's the calendar or rhythm method. So with this method, you need to have a history of the woman's cycles for the past 6 to 12 months. And a woman is fertile 5 days before and 1 day after ovulation. Barrier methods of contraception can be used during this time to prevent pregnancy, but this calendar or rhythm method also helps predict when the ovulation is happening. Okay, temporary contraception. Abstinence is the number one, just not having sex, right? Hormonal contraceptives, a form of temporary birth control, prevents ovulation, makes the cervical mucus thick and resistant to sperm penetration, makes the uterine endometrium less hospitable if a fertilized ovum does arrive at the cervix or the uterus. Oral contraceptives are a temporary one because you can stop it at any time. But again, most of these do not, this one for sure doesn't, but most of these do not protect either partner from STIs, including HIV. So that's on the test a few times if I remember right. So just know, what prevents against STIs as far as birth control. Okay, oral contraceptives. So we're on page 270. So the pill, right? That's what we know it as. Thickens cervical mucus, alters decidua of the uterus, preventing implantation of that sperm. Contraindicated for patient history of thrombophlebitis. Failure rate is 1% if taken as directed. If one pill is missed, it's important for us to teach our patients that you take it as soon as you tell her to take it as soon as she remembers that she missed it. Okay. Oral contraceptives are very popular, they're effective, and they're reversible. They contain either combined hormones of estrogen and progestin, or progestin alone is the mini pill. Requires a prescription. Taking the pill at the same time every day is important to maintain a stable blood level of the hormone. That's a very important thing to teach your patient. It reduces risk of ovarian and endometrial cancer, unfortunately increases the risk of breast cancer. So it can be a trade-off. The mini pill. So you can read about the contraceptive regimens, you can read about the extended dose contraception, things like that. You've probably already learned about it. But I wanted to talk about the mini pill. Did I already go past it? No. Because this is what a lot of women use who are breastfeeding. Contains only progestin, works in the same way as a regular pill, but less effective in suppressing ovulation. So progestin only, the mini pill may be used until menstruation returns in women who breastfeed regularly. And we'll talk about the breastfeeding. Okay, so the different regimens that are out there are monthly, extended dose, induced amenorrhea, which results in a menstrual period only once every 3 months, delayed menstruation, implants, injections, transdermal patch, we'll talk about all these, vaginal ring, and IUD. And important, especially for the test, to remember that a woman should feel for the string periodically, especially after her period, to confirm the presence of the IUD. Do you know that we have found IUDs in women's uteruses? Sometimes we can't find them. They migrate sometimes. That's a rare thing. Anyways, and then I thought this thing on the right was really cool. It's an old type of IUD, and I just thought it was really cool, an old metal one. Okay, so follow-up care for women taking the pill is yearly pelvic exams, pap smears, breast examinations, and blood pressure measurements. Side effects of the pill can be nausea, headache, breast tenderness, weight gain. That's one of the biggest things I've heard women complain about, is the weight gain. Spotting between periods or amenorrhea, can be either estrogen or progestin related. So again, that's where sometimes it has to be adjusted what type of pill. After term delivery of a baby, the pill can be started about 4 weeks postpartum, but oral contraceptives can decrease volume of breast milk, so don't start the pill until milk is well established. And most good doctors go over all this with the patient when choosing what kind of birth control to use after delivering the baby. Okay, so this is in here too, but just as a review, contraindications to using the pill. Any vascular conditions, stroke, previous stroke, or clots, estrogen-dependent cancer, breast cancer, diabetes with neuropathy, retinopathy, liver disease, smoking, impaired liver function, age older than 35, confirmed or possible pregnancy, undiagnosed vaginal bleeding, and migraines with an aura. I thought that was interesting. I don't know why, something with hormones, but obviously, but I'm not sure what. Okay, so A 16-year-old female comes to the family planning clinic for contraceptive advice. She says she wants to take the pill. Her vital signs are within normal limits. What assessment information is a priority? Is it exercise, nutrition, smoking history, stress? Yes. Hopefully you guys picked smoking history. Then there's this aches, which is really good, and this is the memory jogger on page 271. So the first is abdominal pain, severe, and this is the what to report to the doctor if the patient's taking the pill and has this, okay? Chest pain, dyspnea, bloody sputum, okay? Did they throw a clot, right? Headache, severe headache, weakness or numbness of extremities. Eye problems, severe leg pain or swelling, speech disturbance. Are they having a stroke, right? Okay, and super important to educate your patients that if they're taking the pill and get prescribed any of these medications, it may decrease the effectiveness. So antibiotics such as ampicillin, tetracycline, and by the way, tetracycline should never, ever, 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 ever be given in pregnancy. It causes teeth to be stained in the newborn, really bad black teeth when they grow in. Anticonvulsants can decrease effectiveness, rifampin and barbiturates. So that's super important that if they get put on those, that they use other forms of birth control, either with it or instead of it. Okay, education. We need to tell them with the pill, proper use can increase effectiveness. Combination pills come in packets of 21 or 28 tablets. Again, important to take the pill at the same time every day. Keeps the blood hormone levels stable. Review what to do if the pill is missed. Certain drugs such as antibiotics can interfere with effectiveness. Okay, moving on to implantable contraceptives. So one of them is Implanon. It's a single silicone rod that uses different hormone. It's inserted subdermally. It's kind of wicked watching it go in, but they numb it. Provides contraception for 3 years, which is a nice alternative for some people. Does not affect bone mineral density, so older people can use it, and can be used during lactation. Another very useful thing. A lot of our doctors put that into people that keep having babies and aren't very good at, I mean, of course with their permission, but aren't very good at using birth control in between babies. And can be inserted or removed in outpatient clinic under local anesthesia. So it's a really good alternative for some people. Then there's injectable contraceptives, the main one being Depo-Provera, and it's long-acting injectable progestin. Alters cervical mucus, so it's hostile to the sperm, so it impairs ovulation and implantation. It's a single injection every 3 months. And the thing about that you have to warn people is they could have a problem getting pregnant for up to a year after getting a shot. So we just have to tell people to be aware of that. And of course, for a lot of these, you want to make sure they are not pregnant first. So for this one, it's super important to know if they're pregnant. So they do a pregnancy test before the first injection. Side effects: menstrual spotting, headache, weight gain. Does not protect against STIs. I think you guys have pretty much gotten that. You have to know what ones do and what ones don't again. All right, IUD. So a lot of people like this because it gives them a lot of freedom, and it's reversible. So this is a small T-shaped flexible little device that's inserted by the healthcare provider. It's much easier to use for people that have had a baby before, just because to get up through the cervix, and a closed cervix in someone who's never had a baby can be pretty difficult. Okay, it provides continuous pregnancy prevention. It's most often prescribed for women, again, who've had a pregnancy, not recommended for women with multiple sexual partners, and again, doesn't protect against STIs. So contraindications for IUDs, again, remember the 3 stars means that I added the slide, but we are on page 272. Contraindications are if they have liver disease, a copper allergy because it emits copper, breast cancer, immunodeficiency disorders, immunosuppressive therapy, uterine abnormalities, pelvic infection or disorder, undiagnosed vaginal bleeding. But the good news is that upon removal of the IUD, fertility rapidly returns. Okay, so then there's these hormonal skin patches. And they're applied to the dry skin of the buttock, abdomen, or upper arm, or the torso on first day of menstrual period. So what the women do is you teach them to wear the patch for a week and replace it each week for 3 weeks, and then week 4 is patch free. Advantage is consistent level of hormone in the blood and avoids liver metabolism. But it's not recommended for women weighing more than 198 pounds. I think it's because the hormones, it might not be enough. Then there's this vaginal ring. This is on page 273. It's a flexible silicone ring inserted into the vagina for 3 weeks, 1 week break for menstruation. Provides a steady low-dose hormone. Leukorrhea and vaginal infections can be a common side effect of this, but fertility does return rapidly after the ring is discontinued. Failure rate is about 9%. Then we move on to barrier contraceptives. Okay, so this kind of got messed up because with spermicides and diaphragm cervical caps, it kind of was all in one here. So just bear with me. We're on page 273. So a diaphragm, it's a latex or rubber cup surrounded by spring or coil that fits snugly over the cervix. You can see the picture on the right-hand side, what it looks like before it goes in and then once it goes in. Can put spermicidal cream or gel in dome and around the ring, which you should do because it just really will help ensure birth control. What it does is it prevents passage of sperm into the cervix, but it does require fitting by a healthcare provider, and if a woman loses a lot of weight or has a baby, they should recheck the size to make sure it still fits correctly. Absolutely contraindicated in patients with a history of toxic shock syndrome. That can be deadly. Okay. So again, with the diaphragm, it holds spermicide in place against the cervix for the 6 hours it takes to destroy the sperm. Can be inserted up to 4 hours before intercourse, so it can provide a little more spontaneity. Spermicide must be inserted into vagina each time intercourse is repeated. So that part really needs to be, the patient needs to be educated. Don't leave in place longer than 24 hours. That can increase risk for toxic shock. Cannot be relied on to protect against STIs. Failure rate is 6%. Okay, then there's this little cervical cap. I don't hear of them being used very often, but it's available out there. It's this cup-shaped device. It's smaller than a diaphragm, and it's placed over the cervix, and its suction keeps it there. Not all women can be fitted for this. It can remain in place 24 to 48 hours. And again, just like a diaphragm, it should be fitted after childbirth or weight loss or surgery. Then there's this little thing called a vaginal sponge. It's a soft sponge that contains a spermicide and is moistened thoroughly in water and inserted by the woman. It can cause some dryness for the woman, so they need to be aware of that. But it can be left out. Loop facilitates removal, so it has this little loop. You can kind of see the sides of it on the sponge in the picture. Facilitates removal, can be left in place up to 24 hours after intercourse, so a woman can have a little more time with that. Now, we should teach the women about signs of uterine infection, which would be, of course, pain, foul-smelling drainage, or fever, and of sensitivity to the product if they start getting itching or irritation. They should also be taught to report signs and symptoms of urinary tract infection, because a lot of these things, you know, the bladder is right there and can really be pressed on by a lot of these things. And so it can cause urinary tract infections. So fever, pain, burning with urination, urgency, or urinary frequency are signs of UTIs. Side effects and contraindications. So for a lot of these, you've got to make sure that the patient isn't allergic to latex or spermicides. Pressure on bladder, again, may increase UTIs. A friend of mine, she was my charge nurse when I worked down in Southern California. She was telling me how she found out how her husband had an affair. She said she kept getting these, he'd go on fires. He was a fire captain or something, and he'd go on fires and come home and they'd have sexual intercourse, and she'd get this weird reaction every time. And she finally went to her doctor. Come to find out, she was allergic to that latex, and he was using a condom with his girlfriend and come home, take the condom off, of course, come home, have sex with his wife, and that's how she found out he was having an affair. What a way to find out, huh? Anytime's not a good way, but anyway. So barrier contraceptives. Part of them are condoms. There's male condoms and female condoms, but look at the failure rate, 18% and 21%. Okay. So male condom. It's a flexible sheath worn over an erect penis. It's inexpensive, accessible, effective. 3% failure rate if used with spermicides. You know what it said? That failure rate, I think that was the female one. 2%, failure rate 2% or less. I'm sorry, failure rate is 3%. If used with spermicides, failure rate is 2%. Sorry, on the previous one, I think that was the female condom. 4 basic features differ among condoms. The material is latex or polyurethane. There's different shapes. There's different textures. There's different lubricants and spermicides that can be used with it. So things to remember to tell patients are about the latex condoms: prolonged storage in hot, humid climates or contact with vaginal antifungal creams. Suntan oil, oil-based lubricants like petroleum jelly will break down the condom. So need to use, and I would know this for the test if I remember right, water-soluble lubricant to reduce risk of breakage. Okay. Then the polyurethane, less constricting fit, more resistant to deterioration, may enhance sensitivity, compatible with oil-based lubricants, and they do help protect against STIs. Okay. Female condom, thick and lubricated. You don't hear of these being used very often, but it can be inserted up to 8 hours before intercourse, over the counter and single use only. You don't use it with a male. It's either or, male or female condom. Failure rate's 21%. Okay, again, mechanical barrier methods. This is one that's just kind of trying to help put it all together here. Chemicals or devices prevent transport of sperm to cervix or implantation of fertilized ovum. Spermicides inserted at least 1 hour before coitus. You can see on the right the different kinds of spermicides you can get. Rarely effective if used alone. They always need to be used with a condom, diaphragm, or cervical cap. Okay. Then more on the vaginal spermicides. They help immobilize and destroy sperm, and they block the entrance to the uterus. It's just kind of that is up there to block and kill, right? It neutralizes vaginal secretions, but viruses and some other pathogens are not susceptible to these spermicides, which is interesting. Cannot be relied on to protect against STIs again. Okay. And again, spermicides, usually you use them with the cervical cap and the diaphragm. They are activated when exposed to body warmth in the vagina. They're short-acting, inactive within an hour after insertion. A single application provides protection against one ejaculation. Can be messy, it can leak everywhere, but it's low cost, safe, failure rate 21%. So spermicides always have to be used in conjunction with something else if you want good coverage. And then in the case of oops, right, is emergency contraception, also known as the morning after pill. It prevents pregnancy, and it's most effective if you take it no later than 72 hours after unprotected sexual intercourse, but it has been proven effective up to 120 hours, but you can't count on that, right? Best by 72 hours. So the one-step emergency contraceptive plan may not be as effective in women weighing over 165 pounds. So do you see all the education that goes along with all this if you work in that type of environment? Okay, most of these are available over the counter. Side effects include nausea, vomiting, breast tenderness, menstrual irregularities, and of course, non-compliance with the regimen is the most common cause of failure of the morning after pill. Then we get to the truly unreliable contraceptive methods. Coitus interruptus, withdrawal. Man withdraws the penis from the vagina before ejaculation. It prevents a large quantity of sperm from being deposited, but you know, we've talked about how those little sperm can be quite the swimmers, and it can go fast if the man misjudges the timing and withdraws too late. Also, fluid that escapes from the penis before ejaculation can contain sperm. Not reliable. Douche, postcoital douche, sperm are known to appear in the cervical mucus within a seconds after ejaculation, so the douche isn't going to do anything to help that. Sperm can reach the fallopian tube fast. Once sperm are in the tube, forget it. Douching's not going to do a darn thing. Breastfeeding. It's a misnomer that breastfeeding prevents pregnancy. It depends on how much you breastfeed, how long the baby's at breast, all kinds of things. Breastfeeding does inhibit ovulation because prolactin alters ovarian response to hormones and return of menses. But again, frequency, intensity, and duration of breastfeeding maintain an ovulatory status for 4 to 6 months. Then prolactin decreases and ovulation returns. These are the ones that you see come back in 10, 12, 13 months. We call them Irish twins, having another baby because they thought breastfeeding would prevent it. So again, pregnancy can occur before menses returns. So that's what fools a lot of women. Providing 10 breastfeedings in a 24-hour period can inhibit ovulation due to that increased prolactin secretion. But again, it's not reliable. So permanent contraception. We're on page 277, and I wanted to add this little part of it. It's almost 100% effective. Some can be reversed, but it can be, you don't know if it's going to work, and it can be very expensive. The legal aspects of it are they should be given informed consent, risks, benefits, alternatives, and a statement that procedure is permanent and may be irreversible. No absolute guarantee that the procedure will prevent pregnancy. And some states require a 30-day waiting period to get your tubes tied. I know in our state, they have to have it's either 30 or 60 days the consent signed in advance. But I have to tell you, we had a patient come in having a baby, and she was a little bit older, and she was just telling me how this wasn't a planned pregnancy. And I go, oh, and she goes, yeah. She goes, my husband had a vasectomy, and I had my tubes tied, and here we are having a baby. What are the odds of that? So I just said to them, and of course they'd accepted it and were excited about it. And I said, this baby is meant for great things. This baby was meant to be. Okay, so let's talk about male sterilization first. And of course, the advantages and disadvantages to this, it can be very permanent, but there's also in permanence can come issues. What if there's a divorce and you decide to have children with the next spouse? What if you, and again, remarried, or death of a child that you decide you want more children? Change in attitude towards having children. My stepdaughter wasn't going to ever have kids, and she got in her 30s, and now she has 2 wonderful boys. So some people may regret that decision if they make that decision too early on. And so for a vasectomy, it's a minor surgical procedure. They make a little incision, and the vas deferens is severed and occluded. It takes approximately 6 weeks and up to 36 ejaculations to clear the remaining sperm. The couple is advised to use another method of contraception for that time, and so on follow-up visits, usually what happens is they have the guy go in a room and ejaculate to make sure there's no sperm, living sperm floating in there. and can be reversed in some cases, but you have a lot of scar tissue and things that can affect it. And it's a misnomer that a lot of men think that it will have an impact on their sexual performance, but it's been proven that it does not. Okay, and down there, the pictures, you can see the procedure of doing that. So it's usually an outpatient basis. Again, it takes only about 20 minutes to do. There's some pain, bruising, and swelling after that, but usually just an ice pack, rest, and some analgesic usually is all they need. They need to report, of course, if they have bleeding or substantial bruising or the incision site separates. Again, vasectomy, sterility is not immediate. I would know that for testing purposes. Birth control is needed for 1 to 3 months after the procedures to make sure all the sperm has left the system. Okay, 100% juice, no seeds. That's what we want. Okay, female sterilization. So for women, it's kind of painful to go in and have this procedure just because they blow them up with air. And so it can just be uncomfortable for a while after a woman has this done. I always tease the men and say, I'm sorry, it's your turn to get a vasectomy. She just had a baby. It's your turn to have some pain. But they all have different, thoughts on that, of course. Tubal ligation is a surgical procedure, and it can be done in different ways. And you can read all about that. Neither protect against STIs and does not affect menstruation or sexual performance. But nursing responsibilities, again, but listen to patients' concerns, verify information regarding benefits, risks, and alternatives, provide emotional support. For some people, it may be a very sad thing. You're ending some women feel their womanhood, some men feel their manhood when they can't produce children anymore. And discuss what to expect and signs and symptoms to report. Okay. So moving on to perimenopausal and menopausal women. So menopause is the cessation of menstrual periods for a 12-month period because of decreased estrogen production. See that estrogen again? So important. Climacteric is change of life, also known as the perimenopausal period. And oops, I need to change that. Anyways, it's 2 to 8 years before menstruation ceases. Pregnancy can still occur during this time, so women have to be very careful. That's when you hear women coming in at 45, 48 years old having a baby. Because the last menstrual period usually occurs between age 45 to 50. Okay. So menopause, psychological response affected by expectations, marital and financial stability, family views, and social or ethnic cultural values. Were they ready? Like my husband, whose wife passed away, she had 1 child, and she went into early menopause. She could only have 1 child. She was only in her 30s. So menopause can affect people in different ways in different times of their life, very unexpectedly. Okay. So physical changes. It's all a result of the lowered estrogen levels in the woman's system. Uterine endometrium and myometrium atrophy, so the lining of the uterus, right? Vaginal mucosa becomes smooth and thin. Rugae disappear, loss of elasticity, mood swings, hot flashes, all kinds of really fun things happen to the woman, right? And decreasing estrogen also causes her to have the risk for osteoporosis, arteriosclerosis, and an increase in cholesterol levels of the blood. Doesn't it sound like fun? Yeah. So the hot flashes, the woman may also notice chills, palpitations, dizziness, tingling of the skin. It's all part of that vasomotor instability. And I absolutely loved this cartoon. Kathy's hot flashes were becoming severe. She's in a swimsuit in the snow with a fan. I just thought it was hilarious. So it's changes in the menstrual cycle, of course, vasomotor instability, known as hot flashes, decreased elasticity and moisture of the vagina, can have painful intercourse. Some may notice a change in libido, sexual desire, breast atrophy, loss of protective effect of estrogen on the cardiovascular and skeletal systems. all kinds of bad things happen for women with menopause. Gonna have to have a talk with God about that someday. It's just kind of a sucky thing, right? But the one positive is not having periods anymore for women, right? Okay, so psychological and cultural variations, it can threaten the woman's feelings of health and self-worth. But again, liberation from monthly periods and ends fear of unwanted pregnancy. But I liked this little statement. So much of our sense of identity as women and a whole heap of feelings about getting older are tied up into our fertility and menopausal status. That's just a fact. I just thought that said it so well. Okay, since menopause can cause so many issues, like estrogen increases the amount of high-density lipoproteins, which carry cholesterol from body cells to the liver for excretion, so we can get higher cholesterol in our blood because that's no longer happening. And so again, the cardiovascular and skeletal, estrogen assists with the deposition of calcium in the bones to strengthen them. So when we aren't having as much estrogen, we're losing that calcium, and that leads to osteoporosis, right? And osteoporosis is a leading cause of vertebral, hip, and other fractures in postmenopausal women. Bones can become very fragile. So treatment options. Exercise is very important, especially weight bearing. Increase in calcium, magnesium, and a high fiber diet. Hormone replacement therapy, that's again something that needs to be discussed with the healthcare provider. Some people need it, some people don't. Depends on what other comorbidities the patient may have. There's also complementary and alternative therapies and therapy for osteoporosis. So encourage foods rich in calcium, milk, dairy products, green leafy vegetables. Calcium and vitamin D supplements can prevent complications, and they should be taken together. Weight-bearing exercises such as walking, hiking, stair climbing, dancing. High-impact exercises should be avoided, though. Fosamax can be used to help prevent potential fractures, and bone density studies can help a woman know what her status is and what she needs to continue doing or do more of, right? So here's your osteoporosis. It's a degenerative musculoskeletal disorder. It's a decrease in bone density that leads to, like holes, porosity, more porous to the bones, and makes a woman more vulnerable to fractures. Okay, we're on page 279, okay? And no, 280. Sorry. Therapy. Risk factors and therapy for osteoporosis. I think this is an extra slide I added that I forgot to put the stars on. So risk factors are Asian descent, small boned, fair-skinned whites of Northern European descent. It's kind of funny, my sister is more olive complected, black hair, blue eyes. I'm fair-skinned, red hair, short, she's taller. I'm small boned, she's big boned. And I always said we could take half of us each and have the perfect body. Anyway, and it's funny because I drank way more. I have a much better diet as far as my taking in calcium and proteins and things like that. My sister's a vegetarian. Anyway, so I just thought I was going to have way, way, way better bone density than her. And we went and got tested together one day, and hers was a little bit better than me. And I was just stunned. And the lady doing the test said it was because my fair skin, short, blah, blah, blah. It was very interesting. It was sucky too. Anyway, risk factors: early menopause, decreased levels of estrogen. The earlier, of course, you go into menopause, the more you're going to get drained of your calcium. Sedentary lifestyle isn't good for that. Inadequate calcium intake, caffeine, alcohol, smoking, and long-term use of steroids, of course, we all know is not a positive thing. Nursing care of the menopausal woman. Determine women's understanding of risks, benefits of hormone replacement therapy. Teach signs and symptoms to report. Teach women how to take prescribed medications so that they are effective. And teach value of weight-bearing exercises. I liked this picture. Fitness for menopause. It's awesome. Contraindications to hormone replacement therapy is, of course, if the woman gets pregnant, unexplained vaginal bleeding, active or chronic impaired liver function, breast cancer, because a lot of breast cancers are estrogen related. We add estrogen to it. Woo, not a good thing. Endometrial cancer, except in certain circumstances, and recent vascular thrombosis with or without emboli. All right. Hormone replacement therapy increases a woman's risk of breast cancer. True or false? That is true, but it reduces a lot of other kinds of cancer, okay? Okay, now we're on chapter 34, complementary and alternative therapies in maternity and pediatric nursing. Here's your objectives. You can read. We're just going to talk about CAM therapies, which a lot of this Esme went over already for you guys, but we will do some review and just briefly go over it. Okay, so complementary therapy refers to non-traditional, so not Western medicine, right? Therapy that is used with traditional or conventional therapy. So an example, I liked this, it's in your book, of course, on page 779, the first paragraph. An example would be the treatment of hypertension with medication plus relaxation or biofeedback. Alternative therapy refers to unconventional or non-traditional therapy that replaces conventional or traditional therapy. So there's places for both, and a lot of people, more and more, I see people using these types of therapies. So complementary and alternative therapies are also known as integrative therapy, integrative healing, and holistic healing. Complementary therapy is non-traditional, again, with traditional, and for example, massage with muscle relaxants for low back pain. You use them both. So of course the muscle relaxants are Western, and massage is a complementary or alternative therapy. So just alternative therapy is unconventional and non-traditional that replaces. Advantages are offering a variety of healthcare advisors. There's all kinds of them out there. And people really have to be careful who they choose and who they listen to and know what they're talking about. They also offer more patient control over their healthcare. And it's more natural products than chemical ones, and incorporating cultural beliefs and practices, which can make it super cool. We see more and more oils and things being used in medicine these days. So pediatric use of CAM therapies. So the thing that has to be really emphasized is that infants and children are not small adults. They have immature development that can result in they can react differently to therapies than adults do. So that has to always be kept in mind. Some of the side effects can be very dangerous for the children, and some of the therapies can be excellent for the children. You just have to get someone who knows what they're talking about. So increased use of CAM for a variety of illnesses and conditions these days, which is super awesome if we can do that. And many universities have federally funded research programs for pediatrics and CAM therapies. And we always have to remember that care is needed when combining traditional and CAM therapies. And they're finding herbal therapy can be used for children with ADHD, and they're finding some good results. But again, none of this has really been approved by the powers that be, let's put it that way, and we're still in the learning phases of all. Okay. One of the stories I like to tell is one of the anesthesiologists that we have that I work with, who's the most wonderful man. He has 3 daughters. His oldest daughter's in her 20s now, but when she was first born, she was fine, and as time went on, she was I think he said it was when she was first starting to walk. His wife, who wasn't a medical personnel, and he was, of course, kept saying something's wrong. She keeps falling when she walks. And he said, oh, she's fine. She's just clumsy. She trips, whatever. She's just got to get her balance. And it kept happening. So the wife said, I don't care what you say. I'm taking her to the doctor. Well, took her to their local pediatrician, and the pediatrician said the same thing. Nothing to worry about. Then she kept falling and falling and falling. And again, this doctor, very humble. He said he ate the biggest piece of humble pie. He's one of the nicest, most humble men I've ever known. So it's kind of interesting to hear the story from him. And he said the wife kept saying, something is wrong. I know something's wrong. And I always tell patients, listen to your gut. That is so important. Moms know their children better than anyone on the planet. And she listened. So she went to another pediatrician. Pediatrician said the same thing. She's fine. She's fine. You're just being a hysterical mother, right? And it continued for a while longer. And she's like, screw this. So she went to another town to a pediatrician. And this wasn't here. This was when they lived somewhere else. And the pediatrician said, you know what? Let's just hook her up to an EEG and make sure everything's okay. They hooked her up to an EEG. She was having hundreds of petit mal seizures a day. Yeah. So this doctor, that's when he said he ate a big old piece of humble pie. Well, the neat thing about this story, so as the child was getting older, they said there's nothing we can do, nothing we can do. And the mom pursued every avenue she could find to help this child. And the child got to having so many seizures that was wheelchair bound and had to wear a diaper when she was like 8. Well, in your book on page 779, it talks about the ketogenic diet, proven effective in some seizure disorders. In fact, there's a great old movie about it. I can't think of the name of it, but that talks about, it's a true story. Anyway, she found out about this ketogenic diet, took her to, I think, Stanford, to a dietitian there who helped her with it. She came home, and it's kind of the theory of lots of fat it helped line the brain so it wasn't firing so many signals. It wasn't so sensitive, and stopped her seizures. She got out of a wheelchair, got out of a diaper. She's, like I said, she's in her late 20s now, and still, she's definitely affected by it. There's no question. She has disabilities, but she has a job. She has a boyfriend. She's just very, she's slow. But thank God the mother did what she did when she did. Otherwise, who knows if she'd even still be with us. So I just thought that was an interesting example of using this ketogenic diet. Also, chiropractic care has been found to be a good thing, and evidence-based research, of course, or randomized studies are still ongoing, but they're finding a lot of these things to be very helpful. Meditation, guided imagery, biofeedback. They help with anxiety, controlling pain, sleep disorders, asthma, and a lot of other conditions. Acupuncture helps headaches in children, and a lot of pediatricians and gastroenterologists now recommend probiotics. So super cool that we have these things open to us. I just wanted to tell you, I think this is another one that I didn't put star, accepted theories. Unless, wait, is it on this next page? Anyways, accepted theories are gate control theory. We learned about that before. Imagery, we're going to go over all this. Journaling, therapeutic touch, humor, support groups. Of course, humor, laughter is always the best medicine, right? Journaling is just very therapeutic. Okay, so our role as nurses. Cultural competence, again, sensitivity and respect for what these patients' practices may be. There's hot cold theory. There's all kinds of things out there that we may think are totally whacked but work for them, right? And sometimes psychologically it works for them. So the need for nurses to understand chem therapy, how it's used, and how it may interact with or enhance traditional medical and nursing care are crucial. Nurses need to understand basic underlying philosophies and beliefs concerning chem interventions, and we need to respect that. Okay, then there's different kinds of cultural folk healers, and when I was investigating and finding pictures and stuff, it's so interesting to me. All the different ones and what they believe in and stuff like that, and I just found a few pictures here of different methods. The middle one's still not clear on how that hair isn't on fire, but kind of interesting. Just, different methods that people use, right? So on page 780 is this picture, alternative healthcare for kids. So of course the homeopathy. So there's different kinds. There's hypnotherapy, which you can see is, hypnotizing people. Acupuncture can be used different spots. Biofeedback, we'll talk about a lot of these things. Reflexology, therapeutic touch, things like that. Then I found these pictures of, just different cultures again of the healing arts. This first one is just a doctor set in the olden times and the herbs and stuff that they use. The middle one, just another way of treating children. Some of these were the curanderos. And then on the right, not sure what she's trying to do with that baby, but it's a healer working with that baby. Down on the left side, again, if they were doing some sort of therapy. In the right, obviously with a little child doing some sort of therapy. Just so interesting, all the different cultures and what they use and what works, and just very interesting. Okay. So again, our role as nurses, it's not to promote this therapy, but to recognize and respect it and back them up if it's something that we can do, that is safe to do, okay? Use critical thinking skills to determine interactions with traditional therapies. Work with the patient as a partner in the delivery of the health care. It used to always be the doctor ruled it all. Well, it's come a long, long way where the patient needs to be involved in their care. Okay. So it's also important to note that not all alternative therapists are licensed and not all alternative medicines are regulated, and a lot of them aren't evidence-based. So we have to be super careful with interactions. People think herb, they think natural, they think it's safe. Well, a lot of them aren't, especially in combination with other medications people might be on, okay? So the other thing we have to advise people is many health food stores sell herbal products and supplements with unlicensed personnel and people who might not know that much about it giving advice, right, on this product. So it's something that needs to be watched and patients need to be educated, okay? Then on table 34.1, on page 781, it talks about the herbs that should be discontinued 2 weeks before surgery. And you can read about what they do, like echinacea may potentiate barbiturate toxicity, things like that. Some of them you could bleed more, and then like ephedra, it gives tachycardia, which could, you can see it can affect during surgery, interact with anesthetic agents. It can be major, so we've got to be super careful and make sure these people aren't on any of this. A lot of people are on St. John's wort for depression. So if they are, we need to have them hold that. Ginger gets used quite a bit with pregnancy because it's something that's soothing to the tummy. Okay, so again, cautions in CAM therapy. Herbs can interact with cardiac drugs, affect glucose control patients with diabetes, lower the concentration of some synthetic drugs, lower the blood level of some medications for HIV and AIDS, and some herbs, such as Angelica, prolongs prothrombin time, so bleeding time, right? And will synergize the effect of the warfarin. Can you imagine? That can really wreak havoc with the patient. So polypharmacy, a lot of different meds, right, should be avoided. The use of some drugs with herbal remedies can be downright dangerous or deadly. You can read all these, you guys, all the federal regulations that have come into act. So just know that some things are regulated and a lot of them aren't when it comes to herbal and alternative medicine. Okay, so we're going to talk about more of the therapy, okay? So there's a lot of theories out there, and some of them are here: mind-body therapies, deep breathing, guided imagery, biofeedback, hypnosis, chi, yoga. So let's talk about each one of them. Massage. It's thought to bolster the immune response, and we all know it feels so good, right? Rolfing. You need to know rolfing, thought to improve muscle and bone function. The underlying premise of massage is some alternative healing techniques that the symptoms are the result of a problem in the body that may not be related to the specific symptom that's manifested. So massage may help align those things, and the body's thought to have a self-healing ability that may be aided by spinal or energy manipulation. So soft tissue massage is thought to bolster the immune response, okay? And then that rolfing is fascia pressure, fascia in between organs, stretching and manipulation, thought to improve muscle and bone function. Then the coin rubbing, or I don't know how to say it, Kagio, form of skin manipulation that they think helps bring the body into healthy alignment. One thing to know too that I think is on the test also, perineal massage during pregnancy before delivery may prevent the need for an episiotomy. And so it reduces perineal trauma. So the theory is it stretches it out. I do a lot of perineal massage during pushing to help just stretch that out so it's already stretched when the head arrives down to is crowning, and so that it doesn't tear as much. I rarely have a tear when I deliver a baby myself because I do good perineal massage. This is saying in preparation for labor, so you can do both. You can do it during pregnancy and labor, usually at the end when they're pushing. Effleurage, we learned about that sooner. Pain relief, gentle touch for premature infants. Okay. So one thing to keep in mind is foot massage that a lot of women get when they go get a pedicure can stimulate preterm labor in susceptible women. So that's something we need to warn them about. A lot of women get pedicures, especially when they can't reach their feet anymore because they're so far along in their pregnancy, they can't even reach it or see it. So that's a good thing to teach our patients. So massage is contraindicated in patients with cancer, osteoporosis, localized infection, cardiac and circulatory disorders. It's because that increased blood flow to the affected areas. Think about cancer. Do we want increased blood to the cancer cells? No, absolutely not. We want to kill them, not get blood to them to make them proliferate, right? Okay. Then there's osteopathy. Oh, real quick though, I liked this on page 782. Children with Down syndrome are particularly prone to cervical spine anomalies and may be injured by manual manipulative therapy. So children who have a history of sexual abuse also don't usually respond favorably to touch therapy. So we have to keep these things in mind when we recommend different things. Even in the OB world, when women decide not to breastfeed, did they have, were they sexually abused? Things like that. Did the man or the abuser, use their breasts? And so you have to really be careful with different things. And then nipple and breast stimulation and sexual intercourse are CAM methods of inducing labor. So most women are safe to have sexual intercourse during pregnancy unless, of course, they start having preterm labor or a history of preterm labor. That's when we usually put a stop to that. Okay, then back to the osteopathy. So osteopaths, they combine the manipulative therapy with traditional medicine. They use pressure point therapy, so they feel that certain areas of the body are connected to specific identified pressure points, such as you see all these pictures of the hands, feet, and ears. Channels conduct vital energy throughout the body and can guide a woman with previous back problems to select a birthing position that will not aggravate the problem. It just is one of those therapies that gives good guidance. Okay. Then there's energy healing. It's the belief that electromagnetic flow emerges from the therapist's hand and can funnel energy into the patient. It's very interesting. A lot of people really believe this, and who's to say it's not true? I believe that, why not? And some believe that repatterning a patient's own energy field can aid in healing. Body, mind, and spirit are very interconnected and very something we pay attention to these days. And emotions are usually involved in this. Light therapy. To me, this is interesting because it's another form of energy, but this is what we use to treat jaundiced babies, right? When we do Billy lights. And it's very good. I took a class one time on light therapy for people who have depression and seasonal affective disorder. They need the light, and there's certain lights that you can buy for your house that help mimic the sunlight. Then there's reflexology, which uses points in the hands and feet that's thought to correspond with every organ in the body. Massaging these points can relieve specific problems. This picture is in your book on page 783, and it's a transdermal device, and it was cleared by the FDA for treatment of pre-pregnancy induced nausea and vomiting, morning sickness. Oh, I'm sorry, not pre-pregnancy, pregnancy induced nausea and vomiting, morning sickness. And it's applied to the wrist where the median nerve is closest to the surface of the skin. It emits a programmed pulse that stimulates the nerve to create signals to the central nervous system to restore normal gastric rhythm. I think stuff like that's so cool, and why not try it? If it works, awesome. Then there's acupuncture and acupressure. I got to have acupuncture in Thailand at this hospital because I have a bad neck, and it was amazing. Boy, do they go deep, because here in the States I've had it, and it's quite different. Over in Thailand, they're not afraid to get in there and really do it. But the theory of it is there's complex meridians in our body that have these invisible pathways to specific organs or parts of the body. So energy travels to affect acupuncture treatment. It's at these points that positive or negative energy can be realigned. Okay, so the focus of acupuncture is to restore the balance of chi. And chi, of course, is the energy that's thought to regulate body function. Acupressure uses finger pressure, whereas acupuncture, of course, uses those little needles in different parts of the body. Acupressure can be used during pregnancy to control nausea, backache, and pain. But points to avoid are bottom of the foot, inner lower leg, base of thumb, most areas of the abdomen. We worry about, of course, putting people into labor early, things like that. I also think it's interesting that there are 150 points on the 12 meridian sites that positive or negative energy can be realigned through stimulation. Such interesting stuff. Okay. Ayurveda, it's an ancient Hindu healing regimen, and this is on page 784. Deals with biological rhythms of nature, includes music, herbs, massage, aromatherapy, and a tailored diet for certain body types. And this is truly a picture of someone getting together down on the left-hand side, the diet for a certain body type. And on the right, I liked it because it says harmony with nature. So that's what they're trying to achieve. Okay, aromatherapy. This is one of the most popular things these days that I deal with. And I know you've learned a lot about this from Esme. So we're just going to review really quick, okay? It involves the use of concentrated fluid that combined with steam or baths to inhale or bathe the skin. Very important to note that some concentrated oils can cause burns on the skin if used incorrectly. It was kind of funny because I like some of the oils, and past tense is one because, like I said, I have a bad neck and I get headaches. So I usually have a roller ball that I rub on my neck. Well, my daughter had gotten me a past tense because I was running out and put it up in the cupboard. Well, I didn't know she didn't order a roller ball. It was just the bottle full, and I went to roll it on my neck and it went everywhere, and it's kind of strong if it's a lot. My eyes were burning for hours. I mean, it was only on my neck and my back, but the fumes is what I'm saying was so strong that my eyes were watering for hours. I kept trying to wipe it off and get it off and wash it off, and it's hard to wash off. So I was like, oh my God. And I told my daughter, I said, you aren't going to believe it. I dumped it all over me thinking it was a roller ball. But anyway, so you got to be careful. Chamomile, you guys have to know this, is contraindicated in pregnant patients. It can cause abortion and teratogenic effects on the fetus. Remember, teratogenic means it can cause bad things to happen when in development of that fetus. Some essential oils are contraindicated for use during pregnancy because of the effect on mother or the fetus. So anise, juniper, thyme, wintergreen, nutmeg, pennyroyal, and mugwort. You can read more about that if you want, but just know that those shouldn't be used. Also remember, compounds that may be antibacterial, antiviral, antifungal, and anti-inflammatory are used as aromatherapy to provide physical, emotional, and spiritual health and well-being. We use lavender, we use oils. What we do is we put them in a little medicine cup with a cotton ball and put a few drops on there. We have a supply at our birth center and let people smell it. And a lot of people bring their own diffusers and their own oils and use it during labor, which I think is fantastic. So again, remember, lavender, chamomile, and sandalwood essential oils are useful in aromatherapy for children with chronic pain. Remember, we don't want to use chamomile in pregnancy, but for children with chronic pain, these things are very helpful. My grandkids, they put lavender and stuff on, and it's helpful for sleep and relaxation, things like that. There's also ways of using aromatherapy just in the form of placing an article of the mother's clothing with her natural body odor next to the newborn, or if they're in the nursery, the NICU, or something like that, having mom smell there. I also recommend to patients that if they have animals at home, take a blanket that was next to the baby and take it home before the baby comes home and introduce that smell so that they're familiar with that smell when you bring the baby home. They've proven that that really seems to help. So peppermint has also been used as a respiratory stimulant, chamomile to regulate circadian rhythm, and Brazilian guava is an analgesic for preterm newborns. So it's amazing, all the things. Think about, though, if you really look at the origin of a lot of medications, like digitalis, it's a foxglove plant, right? How many of our medications are made from plants? So think about that. Then there's hypnotherapy. So the patient enters a hypnotic state of induced sleep, and it's under the guidance of a practitioner. Now, a lot of people use it for pain, smoking cessation, and pain control. They can get tapes made where they listen to it, things like that. Some patients it doesn't work for because they resist it. They just can't relax enough to get into that state, so they wouldn't be candidates for it. But it can be just very interesting. It's a very relaxed state. It's not a weird thing like you see. I mean, I don't know the ones that work when you see on TV. They make people cluck like a chicken, things like that. That I don't know. I'm talking about just this deep relaxation state that is used. Hydrotherapy, that's a huge one in OB. I use that all the time for my patients. It's therapeutic use of water to promote relaxation. Think about taking a nice warm bath when your muscles are aching or you're tired or you need to relax. You get in there with candles, a glass of wine, some people, or just turn out the lights and just relax and soak in water, how it can help you. Often used during labor, and some deliveries are accomplished underwater. The La Boyer method, which is very controversial. We aren't allowed to do it at our birth center because babies can gulp water sometimes, things like that. And it can be, you don't know what's in the water. But as far as taking baths and showers, it's incredible for labor. Okay, guided imagery. So Lamaze uses this, and what it is based on the ancient Greek belief that the mind can influence the body. So I put this picture down here, and really what it is just focusing on a specific image. So when I have a patient that's in labor and they're having a really rough time, especially during pushing, and they're like, I can't do this anymore, I just get in their face and I say, I want you to picture yourself on the beach or wherever your happy place is. Picture yourself there, and then I want you to picture your little daughter or your little guy running around. How much hair does he have or she have? Things like that. And it really can help them focus. So it's that guided imagery, and it can reduce their stress. And remember, we talked about the P's, and one of them is psyche of labor, and get them so they're not releasing those catecholamines as much, things like that, so that they can get back in focus and push the baby out. So the technique is most often combined with breathing and relaxation to manage discomforts of labor. And sometimes people bring a picture in, some people put a dot on the ceiling to focus on, just depends on what works for them. Biofeedback, type of relaxation therapy that they're hooked up to a machine and enables them to recognize the tension in the muscles to help relax those muscles. Can be used for drug addiction and chronic pain, and is being used experimentally for ADHD kids. Okay, sauna heat therapy. You don't want to use this for pregnant women, because what it is, women get confused a little bit about this. A bath is fine because it doesn't stay that temperature like a hot tub. That hot tub stays heated to whatever, 104 degrees. A tub, it cools off quickly, right? So that's why it's okay, because it's not heating up the amniotic fluid, whereas a hot tub or sauna would, okay? But if you're not pregnant, the thought is overheating the body is used to speed up metabolism and inhibit the replication of viruses and bacteria. Sweating that results from the sauna is thought to help eliminate waste in the body. So a lot of people really like that. Chiropractic care, okay? So it deals with the relationship between the spinal column and nervous system, involves nerve energy thought to be responsible for restoring and maintaining health. Here's the thing though, during pregnancy, circulating hormones such as relaxin increase the mobility of joint capsules, so they have to be a little bit more careful with pregnant women. And know this, you guys, vigorous manipulation should be avoided between the 12th and 16th weeks of pregnancy to avoid stimulating a miscarriage or preterm labor. So you need to know that you do not, you advise them not to go to a chiropractor between the 12th and 16th week of pregnancy. Okay, so, and also most chiropractors use massage, diet, nutrition, enzyme therapy, so it's a more comprehensive approach than just going in and getting your bones cracked. Okay, then let's talk about homeopathy. It accounts for about 25% of pediatric visits to alternative health practitioners. Uses plants, herbs, earth minerals, thought to stimulate body's immune system, belief that disease is an energy imbalance, and that prescribed remedies assist the body to reestablish correct balance. It's usually, those things are, the plants and herbs and stuff are usually taken sublingually, but they advise you not to take with caffeine, alcohol, or traditional Western medicine. And only one remedy is administered at a time, especially because if anybody has a reaction, you want to know which thing they're having a reaction to, right? Okay, so the World Health Organization reports that herbal remedies are often used worldwide and are a first-line treatment for a lot of children in developing countries. And they've been used for thousands of years in many countries. Over 17% of Americans report taking supplements, and that can be vitamins too, we're talking about, right? So herbal products are sold in stores and online, but the process of growth, processing, storage, and contents are not regulated by the FDA. So that's what we're saying, is we don't always know how safe some of them are, right? Because they're not regulated, even though sometimes it's nice to have things not so regulated, but you've got to be careful is what they're saying. And again, herbs that are apparently safe for adults may be harmful for infants and young children, especially if they're combined with other medications. And some herbs have proven their effectiveness for certain health problems like colic. They use fennel, chamomile, licorice, baby mint are used. I've heard baby mint used a lot for babies, and they even rub it on their tummies, and lavender on the bottom of their feet. Ginger's used. Probiotics have gaining a lot of popularity. Aloe vera we use for burns, right? Echinacea, prevention of upper respiratory infections. Tea tree oil is an antibacterial for acne and other things. But dietary supplement labels may not accurately reveal the contents of the ingredients, and some supplements may be unintentionally contaminated with pesticides, mercury, or other harmful ingredients because they aren't regulated by the FDA. So many current medications are related to herbal remedies. So opiates originate from poppy flowers. Quinine originates from the cinchona tree. But some herbs, like ephedra, can be fatal to children, whereas adults use it, but that's one of those drugs also not to be used 2 weeks before surgery. So you see how it can get confusing and need to be careful. And herbal remedies consumed during pregnancy can cross the placenta and reach the fetus. Breastfeeding mothers who use herbal remedies can pass the substance to their nursing children. And chamomile that we use for tea can be contaminated with botulism. So the whole point to this is it sounds so natural and wonderful, but it still has to be used with caution. Okay, objectives for the rest. We're all done. Herbal remedies, they're powerful nutritional agents, and they're made from plants. Most are safe to ingest, at least ones that are on the market, right? Herbal remedies consumed during pregnancy can reach the fetus. Herbal capsules are about 4 times stronger than herbal teas. Herbal extracts are about 4 to 8 times stronger than capsules. Most extracts should not be taken for longer than 6 consecutive days. So there's rules to herbs also, and vitamins, and you can OD on some things and others you can take as much as you want. Like when I get anxiety, my doctor, who's very into, I'm very middle of the road, but my doctor does a little bit of both. And for stress, he has me take holy basil. And it's wonderful, and it's natural, and you can't OD on it. So there are some things that it's just wonderful to have as a backup if you need it, right? Okay, so herbs and obstetrics, again, have to be careful. It helps some women feel a sense of control over their well-being by choosing what they take and don't take. But because they are viewed as natural, again, those natural remedies, they may not be aware of possible dangers to themselves or the fetus or interactions. And we've talked about how different the woman's body is in pregnancy. So think about how it metabolizes things differently also, okay? So in general, herbs that promote menstruation are contraindicated for use in pregnancy. And box 34-2, that's on page 786, talks about the different ones and what we should avoid with pregnancy. Look at aloe vera, garlic, things we wouldn't think. And garlic is just, let's see, I'm trying to remember why. Inhibit platelet activity, may cause bleeding. Remember, women in pregnancy have extra blood, so that can be pretty scary. And remember this, you guys, the ingestion of high levels of vitamin C by a breastfeeding mother can result in colic in the newborn. I'd remember that if I were you. Okay, so common herbs contraindicated. Again, it's on table 34-2. You can read that and see what each thing does. Okay, herbs and pediatrics. Okay, so we know the use of chem therapy is increased for children with different chronic disorders. Again, they can use chiropractic, biofeedback, homeopathy, herbal food supplements. And these herbal treatments can focus on improving cognition, producing sedation, or alleviating anxiety, and most can be obtained without a prescription. You can read the list of right here. Oh, let's see. Herbs commonly used in pediatrics. Yeah, on page 787. Here's a list of them, but you can look at them better and what they do if you want to. Herbs in menopause. So recently more natural paths of management have developed because, menopause is a stage of health within the health illness continuum in a woman's life. It's not approached as a disease or an illness, but rather as a unique stage of life and as a normal, healthy process. That's the way we need to look at pregnancy, and that's the way we need to look at menopause. We may not like menopause, but it is just a part of aging and life, right? Again, things that we can use for that are exercise, relaxation, a good diet, herbs like black cohosh. Now, black cohosh you don't want to use for certain things, but you can use it for reducing hot flashes. And you can see other things that are used for menopause. Now, hyperbaric oxygen therapy is, it uses an airtight enclosure to provide compressed air or oxygen under increased pressure. They're doing such incredible studies with the power of oxygen, even with heart attacks and things like that, putting oxygen into that tissue, things like that. But for children, it's used to revive them after carbon monoxide poisoning, to aid in wound healing. Oops, that's supposed to be wound, sorry. To treat the diving syndrome known as decompression illness and diabetic wound healing. Absolutely contraindicated in pregnancy. You need to know that. Increased oxygen saturation in the mother's blood can cause closure of the ductus arteriosus in the fetus and cause fetal death. So, absolutely do not use in pregnancy. Okay, and I think that's it. I'm going to see if there's one more slide, but hopefully that's it, and we'll talk soon.